Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 198,148 confirmed cases of COVID-19 in Canada and 64,371 cases in Ontario. Chatham-Kent has 371 cases, and Sarnia-Lambton has reported 363 cases. Michigan now has 143,106 cases, with 14,881 cases being in Detroit. Today, we are reporting 2,767 cases of COVID-19 since March, an increase of 3 new cases from yesterday. Of the 3 new cases, 1 is a close contact of a confirmed case, 1 is community acquired, and 1 is still being investigated. 2,637 cases are now resolved, and 54 cases are active and being followed by our health unit. 2 people are currently in the hospital. Our community has lost 76 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. 1 long-term care home is currently experiencing a COVID-19 outbreak, and 3 workplaces are in outbreak, including 1 in the agri-farm sector, 1 in construction, and 1 in the food and beverage industry. Please do your part to prevent the spread of COVID-19. Stay home if you are sick. Limit your number of contacts. Keep 2 meters distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a mask or face covering if you cannot maintain a 2 meters distance from others. Cough into a tissue or your sleeve. And download the COVID Alert app. The app provides you with an exposure notification. In the event you receive a notification, individuals are directed to get tested and self-isolate pending their test results. Please go to www.canada.ca to download the COVID Alert app. Through our tobacco and vaping enforcement officers and our public health inspectors, our health unit continues to conduct regular compliance inspections across businesses, including restaurants and personal service settings. In addition, they follow up on complaints. Since the beginning of September, the tobacco and vaping enforcement officers have conducted 166 in-person inspections and have issued 20 notices of violation. A provincial offense notice was issued this morning to a non-compliant convenience store operator in the City of Windsor. The fine was related to face coverings and was issued under the Provincial Reopening Ontario Act, with a set fine of $750 plus applicable court charges. This charge was issued after observing non-compliance by the operator after multiple verbal warnings and a written notice of violation. Our public health inspectors have completed over 1,200 inspections since September 1st and followed up on 990 complaints. The most common concerns are related to no face coverings or masks, physical distancing not being maintained, not cleaning and disinfecting between patrons, not washing hands, or not having a hand sanitizer available. Please note that all inspections are posted to our website at wichu.org/inspections. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. Influenza season is upon us and we are dealing with COVID-19 at the same time. It is important to recognize that while there is no vaccine for COVID, but we do have a vaccine for influenza. Influenza is an acute respiratory illness that is caused by the influenza virus. Some of the symptoms of influenza include fever, chills, cough, runny nose, sore throat, headache, muscle aches, extreme weakness, and fatigue. The elderly may not have a fever, but they can still have many of the other symptoms of influenza. People of any age can get influenza. The illness usually lasts 2 to 7 days. However, the cough and fatigue can persist for several weeks, making the return to full activity difficult. Some people can become very ill and develop complications such as pneumonia and require hospitalization, and for some elderly, it can also lead to death. Ontario's Universal Influenza Immunization Program is an immunization program which offers influenza free of charge each year to all persons 6 months of age and older who live, work, or go to schools in Ontario. Influenza is ranked among the top 10 infectious diseases affecting the Canadian population. According to the National Advisory Committee on Immunization, or NACI, approximately 10 to 20% of the Canadian population become infected with influenza each year, which roughly equates to 12,000 hospitalizations every year, 3,500 deaths related to influenza every year. In Windsor-Essex last year, there were 200 cases roughly, with no deaths reported. The surveillance system changed quite a lot in the last few years, and it may not be an accurate reflection of the true number of influenza cases in the region, but this is just an estimation of what is reported based on the current surveillance system. Individuals at high risk of influenza-related complications are strongly encouraged to receive the influenza vaccine unless contraindicated. The high-risk group include young children under 5 years of age, especially those younger than 2 years of age. Children aged 6 months to 18 years with neurologic or neurodevelopmental conditions or undergoing treatment with aspirin for long periods of time. Adults 65 years of age and older. Individuals of any age who are residents in long-term care home or other chronic care facilities. Individuals with underlying health conditions, for example, cardiac, pulmonary disorders, renal disease, obesity, diabetes, cancer, or in other kind of weakened immune system. Pregnant women and also Aboriginal people are at a higher risk of developing influenza-related complications. In addition, the National Advisory Committee on Immunization recommends that everyone who is capable of transmitting influenza to those at high risk get immunized. This includes healthcare workers, household contacts of those at high risk, and persons who provide care to children under 5 years of age. While there is no vaccine for COVID, which still exists in our community, we do have vaccine for influenza. The influenza vaccine builds up antibodies against the influenza virus, making it easier to fight influenza infection before it starts. Protection from the influenza vaccine varies from year to year, depending on how well the strains are matched, included that is circulating in the community. Generally, influenza vaccine offer about 60 to 80% of protection when the vaccine and the circulating strains are well matched. Although protection is generally lower in the elderly, studies have shown that the influenza immunization can decrease the incidence of pneumonia, hospital admission, and death in the elderly. It takes about 2 weeks following immunization to develop protection against influenza. Protection may last up to 1 year or longer. People who receive the vaccine can still get influenza, but if they do, it may be milder. Please note, however, the vaccine will not protect against COVID-19, colds, and other respiratory illness that may be mistaken for influenza, but they are not caused by the influenza virus, and it would reduce the hospitalization, need for healthcare services, and overall decrease the burden of disease in our community. So I'm strongly recommending everyone who are in the high-risk group to get the influenza vaccine, and also everyone in the community should get the influenza vaccine to protect themselves and everyone around them. Thank you.
The conference is now unmuted.
We'll now take questions from the media. Today we'll start with AM 800.
Teresa, just in regards to the provincial offense that you mentioned, will you be naming the convenience store, or can you say if it's a city convenience store or a county convenience store?
It is in the city of Windsor, and after the conviction, it will be posted to on our disclosure website. But it's just, I'm looking at the time, it just occurred this morning, so I'm just allowing all the process to take place. But it is a convenience store operator in the city of Windsor.
So this operator has been warned before, like you mentioned, and this operator continues to go against the mask bylaw/order?
It's my understanding that several conversations have occurred, and it is around the non-compliance with the masking order.
And correct me if I'm wrong here, but this is the first provincial offense notice that the health unit has handed out?
This is the first charge, you're correct.
Okay, thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. We've heard from a few pharmacy owners and local primary care providers that they either received a very small number of flu vaccines or none at all so far. And you have said repeatedly that the distribution is ongoing. So is everything still on schedule, and will places that only received a small shipment receive more?
So every year, our health unit is allocated a certain amount, and we are, initially, all of the vaccine goes to the high-risk populations, long-term care and hospitals. So that has already been done in our community, and they'll continue to get supplies of vaccine. What will happen this week is we get our government pharmacy shipment for all of the primary care providers. That is expected today, and we have all of the primary care providers that are actually distributing the vaccine will, on a schedule, we have pre-booked them to come in by appointment to pick up their vaccines, and that will all occur this week. So by the end of this week, the primary care providers that are intending to provide vaccine to their clients will have the vaccine.
Okay, thank you.
Any questions from Blackburn?
Hi, I'm just going back to what Dr. Ahmed said about Windsor-Essex figures last year, 200 cases, no deaths reported. But then the thought that, I mean, a lot of people, when they get the flu or get symptoms like the flu, are never tested. So that number is probably a lot lower than what the actual cases were in the community.
That is correct, and I think that's where I said that because of the testing and because of many people don't even go to the physician's office, we cannot give you an exact number of the true incidence, but it is estimated, according to the National Advisory Committee on Immunization, 10 to 20% of the Canadians typically get flu every year. So if we translate it into our community, roughly we can say that between 20,000 to 40,000 cases that happen, and a lot of them are mild cases, so they don't even go to the hospitals or go to the healthcare system. But those who are at a risk of developing more complications, they get most of the severity of the disease and potentially die. And those are the severe cases that ends up in getting tested.
So any death like in the hospital that may have been related to the flu, they would have gotten that test done while they were in the hospital?
Generally speaking, yes, and but sometimes there's a hit and miss, and that's why we caution. And then when we are looking at the previous year, we reports anywhere between 10 and 30 deaths. In the previous years, last year was an unusual year where we didn't get any of those report. But again, it also depends on the match of the vaccine as well, that how good the vaccine is matched. We have seen 2016, 2017 year, which was probably the worst year, when we have seen many deaths and a large number of outbreaks in the facility. I think, if I remember correctly, roughly 34 or 35 outbreaks of influenza happened in our region, and those are when the vaccine was not a good match. But in the years when we have a good match on the vaccine, and I forgot the exact match for the last year, but it was pretty good match last year as well. So that's why we never see a lot of those complications.
I guess what I'm asking, or why I'm asking this to clarify this, is because a lot of people's criticism of how COVID-19 deaths have been categorized, that they say that just as soon as they're diagnosed with COVID-19, then if they pass away, then it's attributed to COVID-19 when it could have been other underlying factors. So I'm just trying to, I guess, clear up some of those myths. That if it's like flu deaths, obviously last year we had no flu deaths, so you can't compare the two, I guess, is what I'm trying to get at.
No, absolutely. And I think even, and I'm glad that you brought this question up. And let me just tell you, these people, when they are talking about all these conspiracy theories, first of all, flat out, they're wrong. They misquote numbers, they misquote statistics, and they repeat it hundreds and hundreds of times. Doesn't matter where you go on social media or wherever. There are few people who keep on repeating the same message again and again and again and again, and it makes people believe that probably they are right, but they are wrong. So let me just quote you with some of the number with what we are seeing with influenza because that's the disease that we have been dealing with for a number of years. So on an average, as I mentioned, in Canada, what we see with respect to number of cases and the deaths, so approximately 10 to 20% of the Canadian population becomes infected with influenza each year. So obviously this is an estimation, but the fact is 12,000 hospitalization that happens every year. So this is a hard number. The hard number is 3,500 deaths that are related to influenza. So that's a hard number as well, even if we are factoring in all the other cases that are missed. And this happens every year. And when people are saying that COVID is similar to influenza, it's not. So influenza, we don't have any strong restrictions in place. Still, we see 3,500 deaths. With COVID in Canada, since the beginning of this pandemic, with all these restrictions in place, we have more than 9,800 deaths in Canada. And then when we're looking at the number of people who are infected, that is also quite a large number of people, and that is with all those restrictions in place. If you just simply do the maths, the influenza-related death fatality is 1%. With COVID in Canada, it's close to 5%. So those are the hard facts. And even when you're talking about 1% versus 5%, it makes a huge difference, because if you have 1,000 people dying, and if let's say that's equivalent to 1%, and when you're talking about 5%, that's 5,000 people dying. So it's 5 times the death of influenza, and those are all the hard numbers. So I think I would just strongly suggest people who think that this is similar to influenza and everybody survives and there's no doom and gloom, they're mistaken. They do not understand the concept of population health. Even a disease that is widely prevalent at 1% will cause much more higher destruction if you have a disease that is 50% fatal, but the prevalence is very low or at 1%. So I'll let people figure this out, but what I can tell you is all these wrong coding of the number and wrong statistics is a complete way of undermining what is happening with COVID and how many people are dying and how it is impacting the community. So I'll just stop here.
Thank you, Dr. Ahmed.
Any questions from CBC?
Hi, yes. Do you have any recommendations for people who've perhaps been to a number of pharmacies over the past couple of weeks and always find that they're getting turned away for the flu vaccine because there just isn't enough supply? What should they do? Should they continue going to other places trying to get access to it? Should they go earlier in the week? What's your advice to them?
So the pharmacies, and I'll start, maybe Teresa may have other to add. Pharmacy typically gets their flu vaccine directly from the government pharmacies and not through the health unit. So they may, how they receive their shipments, it's really nothing that I can suggest in terms of when it would be the best time. I think generally speaking, yes, if going to the pharmacy is your easiest option that's worked in the previous year and that will still continue to work. But if you want to get in and get your shot, I think it may be a better idea to contact your healthcare provider. Set up a time, and your healthcare provider would know the availability of the vaccine and will try to squeeze you in with the appointment. And then as many of the healthcare providers are setting up staggered appointment time, so you may not even have to sit and wait and pass with so many other people and get your flu shot in a timely manner. So I think that would be my recommendation. But again, everyone needs are different. If you want to set up like a time, then that's the best option. But you can also get with the availability of the influenza vaccine in many of the pharmacies. And I cannot tell, what would be the best time. I think the pharmacies themselves may have some suggestions. I'll let Teresa may add some things as well.
Just to further comment is that we know that there are approximately 100 pharmacies in Windsor and Essex County that have signed up to administer the flu vaccine, and many of them are getting their shipment as well. Like Dr. Ahmed said, we're not responsible for the distribution to the pharmacies. That comes directly from the government pharmacy. Many of them have received their shipments. Some have not. And again, as you would with your primary care provider, if you're thinking of going to a pharmacy, call ahead. Some are booking appointments as well. Some do not have it quite yet. But we anticipate that all of that the government pharmacy is getting their distribution out, their initial allotments to all of the health unit regions. So I would encourage people to call ahead, either their primary care provider or the pharmacy of their choice. But we do have about 100 pharmacies in Windsor and Essex County that have signed up to distribute the vaccine.
Perfect, thank you.
Any further questions from AM 800?
This is for Dr. Ahmed. It's not from me. It's from Bob from CTV. He asked if I can ask a question today. Dr. Ahmed, Bob wants to know how you feel about the low case count a week after Thanksgiving.
Hi, Bob. I do feel good about the cases so far, but as we say that, the Thanksgiving weekend was last weekend, so we are close to the 7-8 days mark since we anticipated that maybe people got together and had all those parties. So this is the time, this is the week that it could be a critical time to see if we see any surge in the next couple of days or so. So what we know from an incubation period perspective, so obviously it can range all the way from 14 up to 14 days, but generally speaking, most people show their symptoms between 4 and 6 days, so which should be between somewhere Thursday, Friday timeline, and that's, let's say, if they develop any symptoms and if they went for testing, the expectation is they probably will get their results either today or tomorrow if they went to the testing. So we may see some changes in the next couple of days. I seriously hope we don't, but that would be the timeline that I would look for. But so far, having said all of those things, things are much better and much stable in our region. And thank you to all the community for following all those recommendations. And I cannot emphasize it enough that without they following the public health measures, we cannot be here. So just thank you, keep doing what you're doing, and that's the only way we can keep our community open, we can keep our economy going, we can keep everything as it is right now instead of getting worse. So thank you for doing all that.
That's all from me and Bob. Thank you.
Any questions from the Windsor Star?
No, thank you.
Any further questions from Blackburn?
No, thank you.
Any further questions from CBC?
No, thank you.
Thank you, everyone.